Did you know that garlic can be just as effective as ibuprofen in reducing fever and inflammation? That's right. Plus, it helps protect your heart, lower cholesterol, and boost your immune system. But can everyone take advantage of these benefits? Unfortunately, no. For some people, garlic can actually be a poison. Curious to find out if you're one of them? Stick around until the end of the video, and don't forget to share in the comments if you use garlic regularly and how you incorporate it into your routine. When it comes to home remedies, teas, or medicinal plants, it's often overlooked that these natural treatments can have contraindications. They can be harmful to certain individuals, toxic when used excessively, and in rare cases, even life-threatening. In today's video, we'll delve into the potential dangers of this seemingly harmless food before you add it to your meals. Is garlic really unsafe for some individuals? What do the researchers say? Wondering if you might be at risk? Keep watching to find out. If you have any of these 8 health conditions, it's best to avoid garlic. Watch until the end, because if you fall into the last category, you should stop using garlic immediately. 1. People taking blood thinners. People who are taking blood thinners such as warfarin, aspirin, or clopidogrel should be cautious about consuming large amounts of garlic. Excessive garlic intake can heighten the risk of bleeding, especially when combined with these medications. The reason behind this is that garlic contains compounds like allicin and ajoin, which have anticoagulant properties. This means they help thin the blood, similar to what these medications do. When you mix the anticoagulant effect of garlic with the medications, the result can be excessive blood thinning, increasing the risk of bleeding or hemorrhages. While it's rare for garlic to cause bleeding, there was a report about someone who had increased bleeding after consuming about 12 grams of garlic, roughly 4 cloves daily before surgery. In another case, an individual noticed significant bruising and discoloration following surgery. This might have been linked to a dietary supplement they were taking, which included fish oil and 10 milligrams of garlic concentrate, both of which can influence blood clotting. 2. Pregnant women. During pregnancy, garlic requires extra attention, especially in its concentrated form. It can stimulate uterine contractions and menstrual flow, posing a risk to the pregnancy. Additionally, its anticoagulant properties, beneficial in other situations, can increase the risk of bleeding during pregnancy and childbirth, an already delicate period for women's health. It's worth noting that garlic can also influence blood pressure, contributing to its reduction. For pregnant women who already have low blood pressure or are taking medication for blood pressure control, excessive garlic consumption can be harmful. 3. People with low blood pressure. If you have low blood pressure, garlic can be a controversial ingredient in your kitchen. Despite its numerous health benefits, it has a peculiar characteristic. It can further lower blood pressure. This is due to the presence of sulfur compounds like allicin, which promote the relaxation of blood vessels and facilitate blood flow. For most people, this hypotensive action of garlic is beneficial, helping to control high blood pressure and prevent cardiovascular diseases. However, for those who already have low blood pressure, excessive garlic consumption can worsen the problem, causing symptoms like dizziness, weakness, blurred vision, fainting, and even mental confusion. 4. People with kidney problems. People with kidney stones should be cautious when consuming garlic due to some specific factors. Garlic, despite its many health benefits, contains compounds that may not be ideal for those with this condition. Firstly, garlic is rich in oxalates, which are substances that can contribute to the formation of kidney stones, especially for those prone to calcium oxalate stones. According to a study, raw garlic contains 360 milligrams of oxalate. So excessive consumption of oxalate-rich foods can increase the concentration of oxalate in the urine, which can promote stone formation. Additionally, garlic contains sulfur compounds that can irritate the gastrointestinal tract and affect kidney function, especially in people with already compromised kidneys. Although these compounds have anti-inflammatory and antioxidant properties, they can exacerbate pre-existing kidney problems in high doses. 5. People with diabetes. Another group that needs to be careful with garlic is those with diabetes. If you have diabetes, garlic can be both a friend and a risk to your health. On one hand, it contains compounds that help lower blood sugar levels, which seems great, right? However, for those already taking medication to control diabetes, this effect of garlic can be a problem. Combining garlic with medication can lead to an excessive drop in blood sugar, causing symptoms like dizziness, tremors, cold sweats, mental confusion, and even fainting. This happens because both garlic and medication work to lower glucose, and the combined effect can lead to levels below the ideal range. Therefore, if you have diabetes, talk to your doctor before including garlic in your diet. They can assess the risks and benefits and guide you on the ideal amount to consume, or even recommend that you avoid garlic altogether, depending on your individual case and the medications you're taking. 6. People with stomach and gastrointestinal issues. Garlic can also be a problem for those with sensitive stomachs or who suffer from gastrointestinal issues. This is due to the sulfur compounds such as allicin, which give garlic its characteristic flavor and aroma. These compounds, although medicinal, can irritate the lining of the digestive system, especially in those who already have some sensitivity or pre-existing condition. This can lead to unpleasant symptoms like gastrointestinal discomfort, abdominal pain, gas, nausea, vomiting, and diarrhea. For people with gastrointestinal diseases, such as irritable bowel syndrome or gastroesophageal reflux disease, garlic can be even more problematic. Allicin can increase stomach acid production, worsening reflux, and can also accelerate intestinal motility, causing diarrhea in those with irritable bowels. 7. People allergic to garlic. Just like any food, garlic can cause allergic reactions in some people. The signs can range from simple itching or redness on the skin to more concerning swelling of the lips and tongue. In more severe cases, the person may have difficulty breathing and in extreme cases, experience anaphylactic shock, which is a medical emergency. Therefore, if you experience anything unusual after eating garlic, don't wait. Seek medical attention immediately. 8. People with a history of bleeding. If you have a history of bleeding, such as ulcers, hemorrhoids, or other digestive problems, you need to be careful when consuming garlic. And attention, women! This also applies to you, especially if you suffer from heavy bleeding during your menstrual period. As we mentioned earlier, garlic contains compounds that can interfere with blood clotting, making it difficult to form clots that are essential to stop bleeding. The same rule applies to people with conditions that already affect clotting. A 2022 study reported a case where a 74-year-old woman developed anemia, likely due to increased bleeding caused by consuming large amounts of raw garlic. The garlic may have inhibited platelet aggregation, exacerbating the effects of her blood-thinning medications and leading to darker stools and other anemia symptoms. This case highlights the potential risks of raw garlic consumption, especially in individuals taking anticoagulant or antiplatelet drugs. People with hemophilia, for example, a genetic condition that prevents proper blood clotting, should avoid garlic completely. The same goes for those who suffer from thrombocytopenia, a condition characterized by a low platelet count, which are the cells responsible for clotting. Additionally, if you're preparing for surgery or a medical procedure that involves incisions, it's recommended to stop consuming garlic at least 2 weeks before to avoid complications during and after the procedure. Even if you don't have any of these conditions, but notice that minor bleeding, such as cuts or scrapes, takes longer than usual to stop, it's important to talk to your doctor about garlic consumption. As we've seen, garlic isn't for everyone. If you fall into any of the groups we mentioned, like people with bleeding disorders, diabetes, or allergies, it's really important to talk to your doctor before adding garlic to your diet. They can help you understand the risks and benefits and guide you on the best way to consume it, or even recommend avoiding garlic altogether, depending on your situation. But if you don't have any of these conditions, you can enjoy all the benefits that garlic has to offer. It's packed with antioxidants and flavonoids, plus it has antiseptic, antimicrobial, antifungal, and anti-inflammatory properties. Eating garlic, especially raw, is great for your heart, brain, and blood vessels. It helps keep your arteries clean, your circulation flowing smoothly, and even strengthens your lymphatic system. If you want to learn more about the benefits of garlic, check out our video, What Happens If You Eat 2 Cloves of Garlic a Day? We explain everything about the scientifically proven benefits in detail. And here's another tip. The best time to consume garlic is on an empty stomach. At that time, it acts as a powerful detoxifier, eliminating toxins and even helping you expel parasites. But that doesn't mean you can't eat it at any time of day. Garlic, with its bold flavor and unmistakable aroma, offers incredible versatility in the kitchen. For those looking to maximize its health benefits, raw garlic, chopped, minced, or crushed, is the best option. You can add it to salads, salad dressings like vinaigrette, guacamole, or even in dips like hummus, for a spicy and flavorful kick. If the intense flavor of raw garlic isn't your thing, don't worry. Cooking garlic in soups, stews, stir-fries, risottos, or roasted vegetables helps to mellow its flavor and aroma, making it more palatable. Another delicious option is to roast whole garlic, wrapped in foil, until it becomes soft and sweet. Roasted garlic can be spread on toast, added to pasta sauces, or even mixed with olive oil for a special touch. For those seeking convenience in the kitchen, garlic powder or paste is an excellent alternative. It can be easily incorporated into seasonings, marinades, and sauces, adding flavor without the need to peel and chop fresh cloves. Garlic oil, with its milder flavor, is ideal for sautéing vegetables, meats, or seafood, and it's also a great option for finishing dishes with an aromatic touch. No matter how you choose to use it, garlic will surely elevate the flavor and health benefits of your recipes. If this video helped you out, why not give it a quick like and share it around? It could really help someone else looking after their health. Do you or someone you know have any of these health issues? Drop a comment and let's chat about it. If you want to stay in the loop with more health tips, just hit that subscribe button and turn on notifications. We release new videos every week. Your likes and comments really keep us going. They show us what you want to see more of. And before you go, check out these 2 videos we selected specially for you. I think you'll love them. Have an awesome day, my friends, and remember to take care of your health. Thank you for watching. See you in the next video. Bye.